Now, the chair of BMA Scotland, Dr Ian Kennedy, recently said the whole health and social care system in Scotland is broken. There is no way that the NHS in Scotland can survive in its current form, can it?
So I wouldn't agree that it's completely broken. What I would say is that it's under the most intense pressure it's ever faced in its entire 74-year existence. So actually where I do agree with Dr Ian Kennedy is we can't keep going the way we've been going. And that's why the interventions we're making, whether that's around pay, whether that's in social care around delayed discharge, whether that's increasing the workforce, all of these will hopefully help us with the extremity of the pressure that COVID has brought to bear on our NHS and indeed our social care systems.
How bad are things currently within the NHS in Scotland?
Challenging, but we're certainly seeing some easing of pressure. I think the 4 to 6 weeks over the festive period, the winter period, those 4 to 6 weeks I think were probably the most difficult genuinely the NHS has ever faced in its existence. And that's not coming from me, it's coming from nurses, doctors, cleaners, porters.
But you knew it was going to be a tough winter. You knew that COVID was still hanging over. Shouldn't we have been prepared for that?
We were prepared, but there's only so much mitigation.
Well, we clearly weren't prepared for that.
No, I think that's unfair. You can absolutely plan and prepare, as we did. Additional investment in social care, additional staffing, international recruitment, etc., etc. You can do all of that, but there's no doubt that even with that mitigation, and I was very upfront, I think in your programme in fact, in saying that even with that mitigation in place, this winter was still going to be extremely challenging. Now the current state, of course, is in the last couple of weeks, few weeks in fact, we've seen improvement in relation to our A&E. It's not easy, but the pressure is easing, and we've had our best performance since May, which is encouraging, but we've got to build upon that.
But still well below the 95% target of patients being seen or transferred within 4 hours.
Sure, which was a pre-COVID target. Again, I'm not going to pretend here, Rona, or I'm not going to insult the intelligence of your viewers by suggesting we're going to get to 95% in a few weeks or even a couple of months. That is going to take time, clearly, but we're on the right trajectory from that really difficult winter where performance was at unacceptably low levels of 55% to around about 70%, with a over 50% decrease in 12-hour waits and 8-hour waits in the space of just a few weeks. So moving in the right direction, of course well below that target, but moving in the right direction.
Mm-hmm. If you or any of your family, God forbid, got ill and you had to phone an ambulance, go to A&E, would you have confidence in the service you were going to get?
I mean, we did. We had to do that in Hogmanay for somebody who's very close to my family for what was a very serious matter. I'm pleased they, in their experience, got the care and attention they needed. That's not everybody's experience. And I'm deeply sorry for those individuals that have to wait too long. So the recovery that we're making, the progress that we're making, I've just mentioned the A&E progress, we're also making progress on waiting times and long waits in terms of those that are waiting for elective care. We're going to continue to do that so people get a service that is far more acceptable and in line with what they expect. But that is, and I have to be upfront, that is a job that is going to take not weeks, it's not going to take months. The recovery of our NHS will take years.
Years?
It will take years, and that's why our recovery plan is a 5-year plan.
If you say years, what cost to society? I mean, people are already needlessly dying because of the state of some of the services we're getting, and you're saying it will take years?
I've always been upfront, and I think this is the same in governments across the UK, that the recovery, the full recovery of our NHS is, and that's why our recovery plan is a 5-year plan. It will take years. That doesn't mean we don't make progress. I've just mentioned the last few weeks in terms of how we've made that progress, but it will take time.
Okay, and we asked our viewers if they had any questions for you, and we've got lots. If you just want to pick up the iPad, Terry here has got a question about A&E.
I've never understood why the hospitals work 24/7 and GPs don't. That's bound to put more pressure on the A&E departments, because that's where people, the first thing they'll do. My question to you would be, has any thought been given to having GPs open at the same time as NHS hospitals?
What do you think of Terry's idea then?
Well, look, I thank Terry for his comments and even his suggestion. Look, I don't think we'll get to a point where we'll have 24/7 GPs. One, we don't have the workforce to do that, but also I think it probably would disincentivise people from coming into general practice if they thought it was a 24/7 service. Many GPs we talk to say they like it because of the work-life balance that it potentially gives them. But what reassurance I would give Terry is, one, out of hours is really important. So he's absolutely right in his premise. The premise of Terry's question is, if you can treat people closer to home, then they won't have to go to a busy A&E department. That's absolutely right. So we'll invest in out-of-hours services. So GPs providing services on weekends, evenings. But also that's why NHS 24 is so important. That is a 24/7 service, and there are clinical supervisors, nurses on the other end of the telephone there to help, to provide clinical advice. And actually through that, we know that the vast majority of people who phone NHS 24, the overwhelming majority, then don't need to go to A&E. So we'll keep bolstering that NHS 24 workforce, which is a 24/7 service.
Okay, we've got another question now, and this is from Helen about waiting lists.
My name is Helen Hanna, and I would like to ask Humza Yousaf, is there any hope of having my hip replacement surgery this year? I've been waiting for over 3 years for my hip replacement surgery, and we were promised last year that it would be looked at, and they said they're not even doing MD on the list. It's just really trauma and cancer patients that are able to have any surgery done. You know, we have to be kept informed and, you know, have an idea of when the surgery will be.
So how long is Helen going to have to wait, and people like Helen?
Well, I really want to say to Helen that I'm sorry for the long wait that she's already had to experience. And the reason she's had to wait as long as she has is because we took a really difficult decision at the height of the pandemic to pause all elective care, all kind of non-urgent or scheduled operations. Now that's something no health secretary would ever dream of doing unless we had to do it, and we had to do it in the extreme pressure that we're facing in the pandemic. So we have this significant backlog that's built up over these last almost 3 years. To answer Helen's question directly, what we're doing now is focusing on those that are waiting the longest, like Helen, to try to get through the backlog for those that are waiting the longest. Because, and I suspect this is the case in Helen's case, we know that people languishing on a waiting list, they'll deteriorate, they'll decondition, and could well end up at our A&Es because of that.
Okay, the next question, if you just want to swipe to the next one. So this is someone from the Scottish Ambulance Service. Now, they didn't want to give their name, they want to remain anonymous, so one of our producers has voiced this up, but let's hear what he's got to say.
I am a Scottish ambulance worker and have been for 15 years. More frequently, colleagues and I are having to work without a break because of the demands on the service. In January, I did a 15-hour shift without a break. It's a challenge. It's made me feel depressed and worthless within my job. Is this lawful? How will you ensure this doesn't keep happening?
I mean, that sounds untenable. I mean, that's shocking.
It's a horrible situation for the individual to be in, and that is not just an individual experience. I know when I talk to paramedics and Scottish Ambulance Service staff, the number one issue they raise with me is rest breaks or the lack of rest breaks. So there's a few things that we're trying to do. One is recruiting more staff, and actually the Scottish Ambulance Service had their most successful single year recruitment, over 550 staff or thereabouts recruited in a single year. So that's going to help. But truthfully speaking, what's going to help the most is reducing that workload. So just what we've mentioned around the demand on the system, and they're just constantly busy going between hospital and response without any breaks at all. So we are working on that. But on the issue of rest, even when the system is under real pressure, our ambulance workers, and frankly this goes for everybody in the NHS, still needs to have a break for their well-being.
The NHS in Scotland has set an all-time performance low under your watch. Do you still think you're the best person for the job?
Yes, I do, because if these issues were unique to Scotland or the Scottish Health Service, then I think people in the opposition, or whether it's media who question, would have a very legitimate point to make, which is, you know, are you or the SNP specifically at fault here? But we're seeing, for example, these same issues plague health services in Wales and England.
People are only really concerned about what's happening here.
No, but of course we are. But I'm talking about context here. So the context is that if this was only happening in Scotland, then yeah, absolutely legitimately, I think people could question: is it your fault as an individual? Is it your political party's fault? But actually, even amongst these pressures, even when we're facing such pressures, we know that Scotland's A&E performance continues to be the best across the UK.
Health Secretary, thanks very much indeed for joining us in Scotland Tonight.
Thank you.